Good morning, students. The second step of nursing process is diagnosis. Diagnosing is the second phase of nursing process. It is the pivotal step. Pivotal means important step in the nursing process. The term diagnosing refers to reasoning process, whereas the term diagnosis is a statement or conclusion regarding nature of the phenomena. In 1982, the conference group accepted the name North American Nursing Diagnosis Association, or in short we call it NANDA. The standardized NANDA names for the diagnosis are called diagnostic labels, and the client's problem statement consisting of a diagnostic label plus etiology, that is the causal relationship between problem and its related risk, is called as the nursing diagnosis. In 1990, NANDA adopted an official working definition of a nursing diagnosis, that is, the clinical judgment about an individual, family, or community responses to actual and potential health problem or life process. Actual means whatever the patient is suffering right now. Potential means what may happen because of the present health condition. That is the potential. A nursing diagnosis provides the basis for selection of nursing interventions to achieve outcomes for which the nurse is accountable. The definition implies, from the definition we can see that the registered nurses are responsible for making nursing diagnosis, even though other nursing personnel may contribute to the process of diagnosing. The domain of nursing diagnosis include only those health status that the nurses are educated and licensed to treat. A nursing diagnosis is a judgment made only after thorough, systematic and data collection. A nursing diagnosis describes the continuum of health states, deviations from health, presence of risk factors and areas enhance personal growth. The type of nursing diagnosis. There are 5 types of nursing diagnosis. First one is actual diagnosis. That means the client problem, that is the present at the time of assessment. For example, are ineffective breathing pattern, an actual nursing diagnosis based on presence of associated symptoms like the patient is having difficulty in taking breathing, shortness of breath, so we can go for it. And it's an actual problem. Patient is suffering with the breathing difficulty, so that is the actual problem. Second is a risk nursing diagnosis. It is a clinical judgment problem that does not exist, but the presence of risk factors indicate that problem is likely to develop unless nurses intervene. That means the risk diagnosis means right now the patient is not suffering, but because of the risk factors, patient may develop if we are not going for the appropriate intervention, patient may develop. For example, all people admitted to the hospital have some possibility of acquiring infection. Third is wellness diagnosis. It describes human response to levels of wellness in an individual, family or community that have readiness for enhancement. For examples of readiness diagnosis are readiness for enhanced spiritual well-being or readiness for enhanced family coping. For this possible nursing diagnosis is one in which evidence about health problem is incomplete or unclear. For example, an elderly widow admitted to a hospital, a nurse noticed that she had no visitors and pleased to have conversation with the nursing staff. So the nurse may write possible social isolation related to the unknown etiology. Then fifth one is a syndrome diagnosis. It is a diagnosis associated with a cluster of other diagnoses. These are the 5 types of nursing diagnosis. Components of NANDA nursing diagnosis have 3 components. They are, first one is problem and its definition, second one is the etiology or the reason, and third one is defining characteristic, how it appears to be, that is the defining characteristic. So a nursing process should have these 3 components. Each component have a specific purpose. First one is the problem or the diagnostic label and definition. A problem statement or a diagnostic label describes the client's health problem or response for which nursing therapy is given. It describes the client health status clearly, concisely in few words. The purpose of diagnostic label is to direct the formation of client goals and desired outcome. Qualifiers are the words that have been added to some Nanda labels to give additional meaning to the diagnostic statement. For example, deficient, that means inadequate in amount, quality or degree, not sufficient. The incomplete, the decreased, lesser in size or amount or degree. Impaired, made worse, weakened, damaged, reduced, deteriorated. Ineffective, not producing the desired effect. These are the some of the definitions which given in the Nanda nursing diagnosis. These are the problem or diagnostic labels. Compromise, to make vulnerable to threat. Second part of the nursing diagnosis, etiology. Etiology is related factor or the reason or the cause. The etiology component of the nursing diagnosis identify one or more probable causes of health problem, give direction to the required nursing therapy and enable the nurse to individualize the client care. So here the below probable cause and activity intolerance. So activity intolerance, insufficient physiological or psychological energy to endure or complete the required or desired daily activity. Related factors include bed rest, immobility, generalized weakness, imbalance between oxygen supply and demand, sedentary lifestyle. Defining characteristics are verbal report about fatigue or weakness, abnormal heart rate or blood pressure response to activity, electrocardiographic changes reflecting arrhythmias or ischemia, exertional discomfort or dyspnea. Defining characteristics. They are the cluster of signs and symptoms that indicate presence of particular diagnostic goal. For actual nursing diagnosis, the defining characteristic, the client's signs and symptoms. For the risk diagnosis, no subjective or objective signs are present. Thus, the factors that cause client to be more vulnerable to the problem form the etiology or the risk diagnosis. So here becomes the definition, a difference between nursing diagnosis and a medical diagnosis. Nursing diagnosis is a statement of judgment that refers to condition that nurses, by virtue of their education, experience, and expertise, are licensed to treat. Nursing diagnosis describes the human response, client's physical, socio-cultural, psychological, spiritual response to an illness or a health problem. Medical diagnosis is made by physician and refers to a condition that only physician can treat. It refers to disease process, specific pathophysiological response that are fairly uniform from one client to another. The diagnostic process. The diagnostic process is used continuously by most nurses. An experienced nurse may enter the client's room and immediately observe significant data and draw conclusions about the client. As a result of attaining knowledge, skill, and expertise in practice setting, the expert nurse may seem to perform this mental process automatically. The diagnostic process has three steps: analyzing the data, identify the health problems, risk, and strength, and formulating a diagnostic statement. First one is analyzing the data. In the diagnostic process, analyzing involves following steps, that means compare against standards, cluster cues, that is generate tentatively hypothesis and identify gaps and inconsistencies. Compare data against standard. Nurses draw on knowledge and experience to compare client data to standards and norms and identify significant relevant cues. A standard or norm is generally accepted measure, rule, model, or pattern. Sorry. A cue is considered significant if it does not have the following points to negative or positive change in the client's health status varies from norms of the client population. The client's pattern may fit within the cultural norms but may vary from norms of general society. For example, eating very small meals and having little appetite to be normal for some group of people. This pattern, however, may not be healthy and require further exploration. Indicating a developmental delay. To identify significant cues, the nurse must be aware of normal patterns and changes that occur as the person grows and develops. For example, by age 9 months, an infant is usually able to sit alone without support. The infant who has not accomplished this task needs further assessment for possible developmental delay. Clustering cues. Data clustering occurs is a process of determining relatedness of facts and determining whether any patterns are present, whether the data represent isolated incidents, and whether the data is significant. This is the beginning of synthesis. Identify the gaps and inconsistencies in data. Data analysis should include final check to ensure data are complete and correct. Inconsistencies and conflicting data. For example, nurse may write the nurse's record, but the patient has not seen the doctor for past 15 years. But during the physical examination, patient says, "My doctor checked my BP every year." All the inconsistencies must be clarified before valid pattern can be established. Second is identifying the health problems, risk and strength. After data analysis, the nurse and client together identify the strength and problems, first determining the problems and risk. After grouping the clustering data, the nurse and the client together identify the strength and problems that support tentative, actual, risk and possible nursing diagnosis. In addition, the nurse must determine whether the client problem is a nursing diagnosis or a medical diagnosis or a collaborative problem. Third is formulating a diagnostic statement. Most nursing diagnoses are written two-part or three-part statement. Basic two-part statement, first have the problem and second is the etiology. Problem statement of client's response in Nanda label and etiology factors contributing the probable response. These two parts are joined by the words related to rather than due to. The phrase using due to implies one part causes or responsible for the other part. By contrast, the phrase related to merely implies a relationship. So when we write a nursing diagnosis, it is always better to write related to. This problem and the etiology is joined by the word related to. For example, patient is having constipation and the etiology is prolonged laxative use. So it is this two words problem and the etiology joined by the word but related to. So constipation related to prolonged laxative use. Severe anxiety and the patient, the reason for that is threat to physiological integrity, possible cancer diagnosis. So it is severe anxiety related to. So here we cannot write due to because due to if we write the prolonged means this constipation is purely because of prolonged laxative, not any other causes. So that we cannot confirm. So we are joining the problem with the etiology by the word not called related to. In East, the alphabet is in many Nanda lists arranged with alphabetizing many Nanda lists are arranged with the qualifying words after the main words. Because when you open your textbooks and see Nanda nursing diagnosis, because they want to write in an alphabetic order, so they arrange the qualifying words in an alphabetic order. That means infection, risk for. So when we write, we should not write like this infection, risk for. We should write risk for infection because this is purely to alphabet the wordings they have written. Avoid writing the diagnostic statement in that manner. Instead, write them as they would be means risk for infection. And the second type of nursing is basic three-part. The PES format include first one is the problem, that is the impaired physical mobility, and second one is the etiology, as we have seen earlier, factors contributing to a probable cause, the incisional pain, and third is signs and symptoms as evidenced by defining characteristic impaired physical mobility related to incisional pain evidenced by restricted turning and positioning. This is the basic three-part of nursing diagnosis. PES format especially recommended for the beginning or in the student nurses because the signs and symptoms validate why the diagnosis was chosen and make the problem statement more descriptive. So better to use in the learning time. It is better to use the three-part statement because it tells us why this problem occurs. And avoiding errors in diagnosis, the common errors which can happen in the diagnostic statement and how we can avoid it. First, identify the patient response, not the medical diagnosis. We are not going for a medical diagnosis like cirrhosis of liver, but rather we look at the patient complaints. Patient is having itching or patient is having ascites or whatever because medical diagnosis require medical interventions. Identify Nanda Diagnostic statement rather than symptom. Identify nursing diagnosis from the cluster of defining characteristic and not just a single symptom. Identify treatable etiology or risk factor rather than clinical sign or chronic pain that are not treatable to the nursing intervention. Identify the problem caused by treatment or diagnostic study rather than treatment of study itself. Patients may experience many response to a diagnostic test and medical treatment. These responses are an area of concern. Identify patient response to equipment rather than equipment itself. Patients are often unfamiliar with the medical technology. Diagnosis of deficient knowledge regarding the need for cardiac monitoring is accurate compared with a statement anxiety related to the cardiac monitor. Identify patient's problem than your problem with the nursing care. Nursing diagnosis are always patient-centered and the form of basis of good goal-directed care. Potential intravenous complications led to poor vascular access. Identify patient problem rather than nursing interventions. Offer bedpan frequently because of altered elimination pattern. Changes to correct diagnostic statement. Diarrhea related to the food intolerance. Identify patient problem rather than goal of care. Goal based on the accurate identification of patient's problems serve as the basis of determination of problem resolution. Change the diagnostic statement. Patient needs high protein diet related to potential alteration in nutrition. That is not the way, but we can write imbalanced nutrition less than body requirement related to inadequate protein intake. Make professional rather than prejudicial statement. Base the nursing diagnosis on subjective and objective patient data and do not include your personal beliefs and values. Remove your judgment from impaired skin integrity related to poor hygiene habits by changing nursing diagnosis. That is not the way, but we can write we can write impaired skin integrity related to inadequate knowledge about perineal care. Avoid legally inadvisable statements. Statements that blame, negligence, malpractice can result in litigation. Diagnosis, recurrent angina related to insufficient medication implies inadequate prescription by the physician. So we should not write like that. Correct the problem identification might treat chronic pain related to improper use of medication. You identify the problem and etiology. So in the previous one, if the patient is not taking medication, we should write chronic pain related to improper use of medication rather than insufficient medication implies some inadequate prescription by the physician. Next is identify problem and etiology. Alteration comfort related to pain can be changed to identify the client problem and cause ineffective breathing pattern related to incisional pain. Advantage. Why we have means what are the advantage of writing nursing diagnosis? It facilitates communication among nurses about a client's level of wellness assessed in discharge planning. It facilitates communication in several ways. Initial list of nursing diagnoses is easily obtainable to a client's current healthcare needs. It also helps in prioritize the client's needs. It is used for charting process progress, not writing reference and providing effective transition of care from one unit to another. It also serves as focus on quality improvement. Limitations. Because the terms are used in nursing diagnosis are different, the use of nursing diagnosis limited to only those in nursing profession and result in confusion among other members of the healthcare team. Thank you. Thank you for listening.